started PAST, Pain Alternative Solutions and Treatments, and wanted to make a direct player-physician access. The players who had not had, who do not have the means to get help, and especially this kind of help, we also wanted to deal with not only their pain issues, but their addiction problem. I mean, you can't get somebody off pain medication when they still have pain. So we have to fix the pain, then wean them off and get them off the pain medication. And I think that's a unique part of PAST, that we have that ability to do so. It goes beyond that as well. It goes into the realm of treating the entire person.
The players are very appreciative. I mean, they've been struggling with their disabilities for many years. You've been batted around and you're flying all over the country to different places. Some of them have been to 3 or 4 different physician groups, and nothing kind of happened. We just need to make sure it is done.
I really feel bad for these guys because these are conditions that need attention, and they live with it. They live with it day after day. It affects their daily activities. It affects their lifestyle. And it's something that, as a chiropractor myself, can help, and you could be part of this whole piece of the pain puzzle. I think the procedure that we do is very beneficial. It helps them along with the other pain management groups in orthopedic. And it's nice finally trying to just join these forces together with everybody working together from a multidisciplinary point of view and helping out these players in need.
The biggest problem that most of the players that I've seen to date have is that they feel like they have no other options besides narcotics. Things like physical therapy, chiropractic, manipulation under anesthesia, interventional pain management in the form of selective blocks, many of the minimally invasive procedures that we have now, such as percutaneous discectomy, can be very, very helpful. Joint ventures between chiropractors and physical medicine, pain management providers like myself can be very helpful for these people. And now they have a choice.
I'm a former professional football player who went on to get his master's degree in counseling, PhD in counseling psychology, and certified in the state of New Jersey as a licensed clinical alcohol and drug counselor. My role is to help and assess the players who are coming in who have an issue with their pain management and obviously long-term chronic use of a prescription medication. The missing piece of the puzzle is, we have to take care of the whole person. So, and again, some people might make that transition and there's no problem at all. Some people might need help making that transition, psychologically, mentally, physically. And I think that's what PAST is really all about.
Randy, how are you?
How are you?
Good to see you.
Good to see you.
Again, very good. Have a seat up there, Rand.
Okay.
All right. How's your knee feeling? Yes, I know. That's why you're here. Well, I understand you're going to have the arthroscopy done at the Endosurgical Center here?
Right, on the good knee, which is my bad knee. Well, I thought it was my good knee. Apparently, there's some things wrong with it, too.
Okay. So
we're going to get it healthy before we do the knee replacement.
Very good. That makes sense. Well, you're the best guys working on you, too, as well. What we're going to do today, Rand, is do medical clearance for you.
Okay.
Okay? In part of physical exam, medical problem, take a little history from you. We'll give you a physical exam. And as well, we're going to get some blood work and a cardiogram.
Okay.
I want to make sure everything's okay before you go in for surgery. Now, the arthroscopy, as you know, is a scope through the knee.
Right.
And I'm sure Dr. McInerney explained everything to you.
Right.
It's work that's going somewhere else.
Are you done?
The other side, I'll make your breakfast.
I don't say the other side.
And we're going to be putting a small instrument in. It's like a little microscope going in there, and we'll be looking at the inside of your knee. I'll show you on the screen, and we'll take pictures for you. How's that sound? That'll work out well. Okay. All right. I'm putting the dilute Novocaine in the joint, just like the dentist would do in their gums. This will allow him to take this area that's pinching the joint here. This will help cut down some of the significant pain. This is his better knee. The other knee we need to replace. This way he'll be able to step down better on this knee during his recuperation from his total knee replacement on the opposite right knee. Randy, I'll shake your hand. You want to shake my hand? I'll shake your hand. All right?
Wow.
Isn't that great?
Okay, we're going to be doing the manipulation under anesthesia for Mr. Randy Grimes. As with most players, you can see that range of motion is important, especially in the lumbar and cervical spine. So we're going to start with the procedure and increase range of motion with the lower pelvis, the legs, and then we're going to come to the cervical spine, which is the neck, and work on that also. Again, his range of motion is decreased. This, if he was ever alert and up, he wouldn't be able to do this due to the restriction. So we're able to get a full range of motion, especially in rotation. You should notice more range of motion. You'll notice that his hips, his neck, and his traps are going to be looser. And we're going to proceed with a follow-up visit with some therapy to loosen up the muscles in addition to the procedure in the office.
What they did to my neck, you know, was just outstanding. My neck already feels better, and it's been hurting for years and years and years, and it already feels better. What is amazing is how short a time it took them from the time they first called me to say, hey, to tell me about the program to this point. I mean, it's only been a few weeks, and, you know, and here I am. I've already had the surgery. I've had, you know, manipulation under anesthesia with my neck, and I'll be back in a few weeks for a total knee replacement. To have all these specialists look at you and take care of you, and to actually perform their specialty on you, God, how do you ever repay people like that? And I just can't say thank you enough.
I'm Dr. Stephen Waldman. Today I'll be taking care of Mr. Robert Brown. He played for the Green Bay Packers from 1982 to 1992. And today we're going to be doing a procedure for him because he has degenerative disease and a disc herniation with some pain related to the nerves that are being pinched in his cervical spine. We're going to be doing a procedure called the cervical epidural. Essentially what we're going to be doing is taking a needle, inserting it in between the vertebrae at approximately this level, at about the 6th or 7th or 7th or 1st thoracic vertebrae. And this is a technique that I developed about 15 years ago to avoid any potential injury to the spinal cord itself. So hopefully Mr. Brown will get some good relief from this procedure. This, coupled with the manipulation under anesthesia that Mr. Brown's about to get and some long-term rehab, we can help this man.
I had 2 procedures done today, and it was excellent. I feel much better right now, and the doctors did an outstanding job.
I'm going to have a biopsy today. They're going to test the condition of the liver today.
Jaheed, what I'm going to do now is I'm going to percuss out your liver. We already had the ultrasound markers, but I like to percuss it out myself. We're going to make a little incision, tiny little nick, enough to fit the needle through. All right. Remember what we talked about?
There you go.
Blow out, blow out, blow out, blow out, all the way, all the way, all the way, all the way, all the way. Hold it. Done. All done. Breathe. Okay? Oh, yeah.
No, it's good. It's good.
There we go. Okay, my friend. We're done.
I needed a liver biopsy probably 8 months ago, and I didn't have a way to get it. This program, this group of doctors, have really opened up the door for me to feel comfortable and confident if something does happen. You know, I can make a call, and I'm pretty sure something will be worked out. I mean, that's the biggest peace of mind that I have right now.
The last time I've seen these many doctors was probably in 1982 at the NFL Combine when I was getting drafted. So that was probably the last time. It was just a class act. I mean, everyone that's involved in the whole program was just a class act. And I was very impressed.
I'm quite impressed with the setup here. And they got all these different doctors all in one, vice going to different locations, seeing this doctor and that doctor at these different locations. Having all the doctors in one place, and so they can evaluate you together and come up with a conclusion about what the treatment for your injury or illness is. It's great.
I really, truly wanted to find out what was wrong with my wrist, and I was really concerned about it. And these guys let me know. They gave me a little schooling on what was my problem, how it happened, where it came from, what it looked like, what would be the genesis of all of the problems that I had. So I see each guy, and they come to me with absolute straight talk about what the possibilities are. The compassion that these people have shows up in the simplicity of how they make things happen. And they're simply about helping people.
The efficiency, the speed of which things happen. You know, you deal with the uncertainty of, okay, I'm sick. Now what do I do? Who do I call? When can I go? You know, am I going to be able to even be seen? But this program pass was like the next day. You can't just start cold. You know, you get sick and then all of a sudden you're on a list and you're, you know, in contention for a liver. It doesn't work like that. But being involved here, it makes that possible. You call, you need something, it's set up, you come, and PASS takes care of it.
I didn't pay doctors and I never got the kind of attention and the respect I received here today. I mean, it was all out, like everybody was all out for you, you know. It's you that they was caring about. It's just like a miracle happened. I mean, like in 2 days, I'm right here in front of you right now, and I didn't see doctors, and I didn't been approved for operation, and I didn't found out what's really wrong with me. If it weren't for you guys in PASS, I don't know what I would do.
Every day, you know, I would hurt. I would wake up hurting, and I would go to bed hurting, and that's no way to live. And that's no way to live. And had not been for a group like this, I would still be like that. We flew in, we were picked up, we came straight to the clinic, we met the doctors, we went straight back to the x-rays, straight back to the MRI machines. You know, we did everything that day. I mean, where in the world are you going to be able to do that? Fly in one day, have your x-rays done, and then read that night and come up with a plan all in one day. You know, I don't think it's possible anywhere other than here.